This is Delhi. Please stand by for our next program. This is All India Radio. In our national program of talks tonight, we bring you a panel discussion entitled Are Young and Lockdown. The panelists are Sapna Bhatia, co-founder and chief content officer of one of Asia's leading education service providers, Dr. Jatin Tarwani, well-known psychiatrist, Sachin Gupta, filmmaker and theatre in education expert, and Amit Arora, media personality who initiates and moderates the discussion.
Hello and welcome to the National Program of Talks. COVID pandemic impacted everyone's life across the globe. Tonight, we focus on how COVID-induced lockdown and restrictions affected the life of a child. My name is Amit Arora, and joining me here in the studios of All India Radio, New Delhi, are three distinguished guests. Please welcome Sapna Bhatia, an education counsellor. Sapna ji, a warm welcome.
Thank you so much for having me on the program.
We have with us Dr. Jatin Tarwani, psychiatrist. Welcome.
Thank you very much.
And our third guest is a filmmaker and someone who specializes using theatre in education. Please welcome Sachin Gupta.
Thank you, Amit.
So let me start by asking you, Sapna ji, ever since the schools have reopened, what learning gaps do you observe among the students?
We've seen that across the board, students have faced gaps in the cognitive development. And if I were to categorize the three broad categories where we face challenges, it is the inability to focus, unable to take instructions very well, and difficulty in sitting for long exams, 3-hour exams. These are the primary areas where we feel that students face difficulties.
And this is cutting across age groups, 7th, 8th, 9th?
Absolutely, across. And this is most apparent in subjects like science and maths.
Okay. Dr. Jatin, what behavioral changes have you seen among the students now that they've been going to school after the lockdown has been lifted, things coming back to normalcy?
So the behavioral problems that we have noticed is increased irritability. That the kind of respect that they used to show to teachers, that is not there anymore. They have forgotten all these things. And they have forgotten how to respect their other peers. Behavioral problems have increased, certain bullying behavior has increased, and there is a cause for it. It's not like that it has increased on its own. There has been many stressors that what happened over the past 3 years. And primarily because of those things, these problems have come, which are noticeable now. They are in school, noticeable by teachers. So the work has already started. There is, the teachers are working to improve those behaviors and again bringing kids back to school and behave in a proper way and learn again in a good environment.
Sachin ji, during the lockdown, I think most of our listeners would agree that we spent a lot of hours on screen, a lot of hours watching television, binge watching web series. How did the consumption of content impact our students?
I think the kind of content they have seen, especially in the last 2 years, there's no filter to the content which is coming on, especially OTT platforms, because in last 2-3 years, you must have seen so many apps have come from different OTT platforms. And I think we need that filter because the exposure to the content, we need either child-centric content, movies or any other program, but that is something which I feel we need to work on.
So screen time did increase, but how can we help? Because if I have to study online, it is both a boon and a bane.
Absolutely. In fact, with increased screen time, what has happened is that they've now become unable to focus in class. That's because obviously the content on OTT platforms is far more engaging than an online classroom. Ever since they've come back to classroom, the biggest challenge that the teachers face is how to re-engage with them. Because a gap of 2 years, it seems only 2 years, but it's a long time in the life of a child's learning development. So one of the things that the teachers have been doing and I've been doing is that we use humor to engage with them.
Okay.
And we are more supportive because we understand that the child is not doing it deliberately, but the child is unable to focus.
Okay.
There are a few suggestions which I'll give you in a few minutes, which I think if teachers across the country could use, tailor them to your own needs. But if you could use them, they would be a great help in re-engaging with the students.
And one effective way of engaging with students, and teachers could probably use that, is theatre.
Yes, I think theatre in education is definitely one interesting tool which we can actually have in the schools because it's mainly more interactive environment. Using that interactive strategies, you can, the same traditional method of education through theatre in education, you can give child a different platform.
So theatre in education could be used for any subject or any specific subjects?
No, it could be any subject.
Okay.
Suppose if you have history as a subject, when we were in school, that was supposed to be something
boring.
Yeah, but just imagine a situation that same history chapter and you have a class of say 30 students, and just imagine 10 students, they're actually part of that chapter, and in front of you you can see that king, like say suppose you're talking about Prithviraj Chauhan or Chola dynasty or struggle for freedom, all that. And just imagine a situation, you have those characters, live characters in front of you, they're talking to you. So those visuals will certainly help you. And also when you do theater in education, it's not just that you are that knowledge, that teamwork, collaboration.
Yes.
You could be very strong communicators.
Right. So one effective way is that the teacher could engage students with art. What else we can do? Because when you said, Dr. Jatin, that one of the fallout has been that students may not be respecting their teachers more. Now that's a huge concern.
That's a huge concern. The things that you mentioned before, the screen, bane or boon, we have been receiving patients. The child who is a patient, the child is watching screen on one side, the teacher's screen that she's teaching. On another screen, the child is engaging in gaming. The gaming has become too much that now they are suffering from gaming addiction. It's a new concept, a disease recognized by WHO, gaming addiction. And because of this, their sleep is getting disturbed. They are playing till 4 a.m. in the morning, then they are sleeping late, then they are not going to school, and some of them have to drop out from school. The children just do not want to go to school. They are not interested because they are super glued to the screen and playing games. The games are so interactive. So for them, when they come to us, the parents have tried everything. They have tried scolding the child, they have tried persuading the child, they have taken help from teachers. Nothing is working. Then they come to us, then we evaluate if there is a comorbid, some depressive symptoms are there, some anxiety symptoms are there, certain medicines are started, certain counseling is given, sometimes they have to be admitted. Earlier this phenomena was known in the countries where this internet was very prevalent, mainly in the Korea and the Chinese country. But now it is coming up in India also, these problems. So now the admission is also necessary sometimes. The problems have become so much, but a way to prevent these things is, as sir said, that theater can help a lot. This is a part of expressive therapies. Sometimes we have in our teams art therapists. They engage a child with the help of art. They ask the child to draw certain things. Then the interaction happens. Similarly with the theater also. With theater and with dance and with music, people, they are expressing themselves. So whatever stress that is inside them, the stress comes out and they ventilate with the help of theater. Some people who are depressed, theater helps in that also. So with that, theater and certain expressive modalities, they are actually helping.
Right.
They should be used. They
Right.
should be used as a lifestyle thing also.
Right.
Not just as a treatment modality, but as a lifestyle thing also in prevention.
Right. So whether it is theater, whether it is writing, whether it is painting, any such avenue of self-expression can help your child. But Sapnaji, coming back to the point that World Health Organization, as Dr. Jatin said, has recognized gaming addiction. How do we handle this?
Yes, so as I completely agree with what both Sachin and Jatin have said. We need to re-engage with them, and as he said, theatre is a very powerful tool, and we can do this through teaching through activities. I understand that it may not always be possible, but if you make the concept interesting, what happens is that the child is drawn in, and for that, the biggest thing that I think we all can do is praise. When you praise a child, the child feels motivated. As a teacher, I have often, praised a child even if it is for something that he should be knowing, because then he feels invested in it. And the moment you get invested in the process, then you can hold back the praise and make him earn it. And instead of just teaching a concept, regurgitating facts, lay it out as a problem, ask them questions, let them arrive at, result or whatever it is that your goal of that particular class is. That way, you are re-engaging and involving him. And the moment he feels that he has accomplished something, then obviously he will look forward to the next class where he can again be praised in front of his peers.
So when you say that teachers, parents should praise the child, could you suggest the listeners of All India Radio a few sentences we could possibly include in our daily lives?
Yes, definitely. You could say, oh, wow, that's great. I never, thought of it like that. Oh, yes, that's excellent deductive thinking. I'll take that next time. I'll do that next time. So depending on what the situation is, you can make him believe or make the child believe that they've actually done something which you are learning from them. And that gives them a sense that, oh, I have taught somebody something today. So obviously, he feels happy. He wants to do more of it. So that is one of the ways which we as teachers, parents, even as friends can motivate each other and be supportive to draw them away from, there's no doubt that all of us are facing depression or, have undergone difficult situations. So to be supportive in whichever way we can is certainly a very helpful tool, I feel.
Sapnaji, I feel like saying, wow, excellent inputs. But Sachin Gupta, coming to you, there is a drama therapy.
Yes.
That can also help us. Tell our listeners, what is drama therapy all about? Who could benefit from it?
I think, it's a very vast subject. I want to share something. We had one mother, it's been like 7, 8 years. So she came and her daughter, she felt that she's in depression and she wanted her to be part of theater. And also, she told me that she's taking medicines and all that thing. So we discussed a lot of things with her mother and we got an idea what has happened and what could be the reason. So later what we did, we tried to create scenarios, like a different perspective to a child. So like when she was coming for theater rehearsals, we didn't share anything that we had a discussion with her mom, but we created certain scenarios based on the discussion we had with her mother, and we gave a different perspective that maybe what if like something has happened with her in school or maybe with a teacher or something. We had given a different perspective, and after 7 to 8 weeks, we could see that difference.
Okay, so we could customize this on the basis of a real life situation that could have happened to someone.
Yeah. See, suppose if you're talking about a child, like anxiety, depression, fear of failure, these are very common symptoms. And there are a lot more things. Maybe if we could discuss this with the child and if we have an idea, rather than communicating directly to the child, we could give a scenario. Because visually, if we present something to someone, not just a child, any person, if you visually show something, you immediately connect with that thing. So we gave a different alternative to that situation, and she could think beyond what has happened with her. And today she's in IM.
Wow.
She's at IM.
Okay, very nice.
Yeah.
So you're saying just changing the perspective towards a certain situation or life could really help you blossom. Very nice. So Dr. Jatin, like Sachin said, whether it is anxiety among children, irritability, eating disorders, it's a common symptom. When do we realize that we have to visit a psychiatrist?
The child himself or herself does not realize that much that they are suffering from problems. They just only realize that there is some kind of distress. The parents see this thing as if there is some kind of dysfunction. For example, academic decline is there, or social decline is there, or the child used to go out and play earlier, now the child is not playing. Child is not socializing, the child is not studying properly. If the parents are seeing that there is a clear-cut dysfunction, initially they may assume that it is due to certain things and they try to correct themselves, sometimes by talking to the child. Okay, when this is also not working, they should consider discussing with some other person. Maybe sometimes they discuss with neighbors and some other relatives. They will also say certain things. Okay, you can try for 2 or 3 days. If it does not work, immediately visit a mental health professional. That mental health professional can be psychologist, can be psychiatrist. So that should be the advice. Of course, initially they can discuss with the teacher also. No harm. But one should not wait too much. It should not go on unnoticed for months altogether, weeks altogether. This is one thing. Secondly, if a child is clearly saying that there is nothing left in this world, they feel so sad, or if the sleep is too much disturbed, they are unable to sleep despite trying, or they are engaging themselves too much, let's say 6 hours in gaming, 8 hours in gaming, and they are ignoring all other things. So when there is either distress or there is either dysfunction, it calls for help, a professional help, a mental health professional help.
But in your experience, Sapnaji, do you think society at large in India still delays visiting a mental health professional?
Absolutely, because there's a lot of stigma attached to it. People don't want to go to a psychiatrist because they think, this is really sad and I'm very unhappy saying it, but they think that the child must be having severe mental problems, to be forced to go to a psychiatrist. Whereas actually it is the most normal and the healthiest thing that a parent can do for a child, because we as parents, even as teachers, though we observe a lot in class and things like that and can be supportive, are not equipped to handle such situations. Therefore, I think we as parents and teachers should talk a lot about to destigmatize visits to the psychiatrist, because that is essential. Just like when you're building a house, you go to an architect.
Yes.
When you're having mental problems, why would you want to solve it yourself?
Right.
You should visit a mental health professional who will be able to guide you. And I think it's very important that all of us do our part to destigmatize these things and make it a normal, supportive, effort. Just like you would go to a doctor for your body, you go to a doctor for your mind. And as teachers, in class, especially post-pandemic, and with the students that I've been interactive with, I'm sure all of us are a little more aware of the fact that now we need to observe their behavior more carefully. And when a student refuses to do classwork or something, I think we need to respond and not react. You can take the child aside, talk to him, listen to him. Don't be in such a hurry to judge him for not doing his homework. Try and figure out why hasn't he done the homework, and tell him. The first thing is that you have to assure him that you're here to support him and get the child to open up. And if you notice behavior that calls for, to be escalated to a higher level, take it to the principal or to the counselor as soon as possible.
Right. And I think it's important for the society to say, I need help. And just like for body, we've got first aid box where you've got the band-aid cotton. We also need psychosocial first aid, and that can be given by anyone, whomsoever you would like to communicate to. But in terms of the content that the children have been watching, do you think, Dr. Jatin, that we need more content which is specific to children?
Definitely, sir. For the period of time, everyone, when they watch something, they learn from it. This is called social learning. So when they have been watching aggression or the use of substance, the use of alcohol from the movies, this has become a norm from movies. And the children, they have learned watching these movies only. When they grow up, they also emulate the same behavior. So the aggression, the taking of substance, it has become a problem now. And sometimes they go on to develop disorder level problem. The aggression becomes a disorder level aggression. The substance use become a disorder level substance use. So yes, the films have been impacting. They impact in other ways also, for example, through the use of advertisements. The child now does not know what is the right body type, what is the right thing. If the child cannot afford, he will just push his parents to just purchase certain things to show among peers. So the child is learning everything from the movies. So it becomes a duty of movie and the film world that they show different kind of content also that is appropriate for children and for society at large, because everyone learns. It's not the children but the adults also.
Right.
And then there should be some categories are there which suggest that only this is for children. But parents should understand this thing. What is the meaning of you underage and what is the meaning of a adult? And they should keep certain level of discipline at home, that children are only watching the children stuff and not the adult stuff. So that should also be there.
But that is where it's so difficult for parents.
Absolutely. In fact, I completely agree with what Jatin has just said. Apart from developing content, I think it is now incumbent on parents to also limit the time the children view such content. Because earlier during the lockdown, it was difficult. And therefore, it was the easiest thing to do to let the child just, be happy sitting in front of it, leaving you to do the other chores. But now that we have come back to regular life, if one can call that, it is very important that we regulate the content, not only in terms of what they see, but also how much they see. I think as parents or even as a mother, if I can ensure that there is certain time that the child goes outside to play and interact with the peers, that will teach him the social skills that were blunted during the pandemic. You also need to ensure that the child eats healthy, because when you eat unhealthy, you are obviously, your sleep patterns are impacted, your health is impacted. And I would like to say that, you need to now relook at the routine that your child is following and make sure that there is time for everything. It was okay in the lockdown because, you had other things to do, but now encourage social interaction.
Okay. As content creator, what's your advice? What could filmmakers and other content providers do?
I think, like he said, we need more child-centric content. Also, movies based on child issues, and not just why just child. Something which could connect with teachers. Something even for parents also. We need content rather than getting into the traditional method of parenting or teaching that information, memorizing that information towards that particular goal. We have exams in March. So we need some interesting content and more creative strategy, more creative ways. And also, I think a lot of violence is coming, especially all these web series. I think we need that filter. We need filter. And even the certificates also. I just want to add one small thing. In our country, we need more categories specifically for kids.
Okay. So that's something that regulator has to do. But from the parents' perspective, like you said, limit the time so that they do all sort of activities, including playing and having social interaction. You also mentioned about eating disorder. So Dr. Jatin, during lockdown, we just had snacks all the time and frequent meals. How do we address this issue so that we eat in a balanced manner?
First of all, but just by thinking that we have to eat in a balanced manner, that can do certain things.
Okay.
But a discipline is necessary for anything.
Okay.
It's not that eating one day in a balanced manner, but 2 days or 3 days. It has to be a consistent thing. One has to decide on what one is going to take in the morning. And that should cover everything from vegetables to different kinds of fruits or different kinds of nuts. They should primarily eat homemade food. If you once go outside and eat outside food, then it is mixed with all the spices and all the oils. It is so tasty that you would want to eat it again and eat it too much. Then whatever dieting you had planned, it goes to the basket.
Okay.
So at that time, it does not work. So eating disorders had happened. They are still there. It's not just the binge eating problems, but there are different other kinds of problems that happened in the pandemic. certain people were having certain body image issues and they were in stress, so they had stopped altogether. That is called anorexia problem, anorexia nervosa. When the girls had become so thin that their body mass index was so less, then they were developing certain other medical problems, absence of menses, depression, anxiety. Then there were other kind, primarily it happens in the female population. Then there were other kinds of eating problems like bulimia nervosa. They will eat too much, then but they have to maintain a body image, so they will throw everything out, either by inducing vomiting or taking laxatives. So this was also a problem. Then there is obesity, the problems which was already there in India. We are already prone to develop obesities and diabetes. But during pandemic, when one is sitting at home, what can one do? Just eat and eat. So obesity problem had increased, and now obesity is again recognized as a disease in itself by WHO. So obesity does not mean only obesity. It's not that the fat is getting stored in the skin layer or just under the skin layer. It is the fat also getting stored in the blood vessels. So that narrows the blood flow to the heart, to the mind, to different organs, which can lead to damage to different organs. So a child having obesity, it's not all right.
So
It's
solutions.
highly damaging.
Let's come to solutions for this final round.
Yes, I think the first thing as parents that we can do for our children is that, we need discipline. We need a routine which the child knows what to expect and when to expect it. That will help them not only, focus on activities that are important, but also explore other aspects of their personality which they were unable to do because of the pandemic. So my first and very strong request to all parents is that make sure your child eats healthy, sleeps at a given time. Don't allow them to stay up late because they've got something to do or they're gaming or and make sure that you spend quality time with them so that you're able to monitor where the child is still showing areas where they are feeling uncomfortable so that you can step in and fill in the gap.
What could we add to the solutions list?
I think for parents, if they can divert the energy to more physical activities, more sports, because you need to release that energy.
Yes.
Either you are watching content 24/7 or you need to release that energy. So maybe more creative physical activity or could be more different sort of activities. And for teachers, I would strongly recommend theatre in education for schools because it's a very powerful tool to communicate a lot of issues in a more creative manner and more strongly.
Okay. Dr. Jatin?
Parents need to find time to talk to the child. They are just not talking. Maybe both parents are busy in their work. Then in the evening, the parents are busy in their mobile phone. The child is busy in his or her own mobile phone. So they are not finding time to connect with each other. Both the parties have to realize that at least 1 to 2 hours, a daily time should be spent just to talk out issues. What are the issues the child is facing?
So switch off the mobile during those 2 hours?
Of course. So a proper discussion should be there. When a child is talking to parents, the child is explaining his or her issues to the parents. Okay, I'm facing bullying in the school. Okay, I'm having these difficulties. My other peers are having certain kinds of mobile phones. Even I want mobile phone. The parents should discuss, okay, why do you want mobile phone? What is the need? What is the want? They should discuss everything. Maybe there are certain sexual harassment problems, sexual abuse problems. So if the parents are playing mobile themselves throughout the day, they are actually neglecting. This is called emotional neglect. Just having a presence, it does not suffice. Just providing money to the schools and to different kinds of tuitions, it does not suffice. One has to spend time. And the parents are the only supporting figure the child has. They should spend time, they should find time, and it should be done in a daily manner apart from balanced lifestyle and a routine.
On the teachers, you were making a very interesting point that now that the schools have reopened, teachers are expecting students to perform at the pre-pandemic levels very soon.
Yes, absolutely. That is something that we as teachers should understand, that it's not as the child doesn't want to do it. It's just that he's unable to do it. So be supportive. Use intelligent students in your class effectively by making smaller groups and use them as peer tutors. As Sachin said, theatre in education or activity-based concept teaching is the best way. Then to ensure and see if your concept has been understood or not, have competitive games, because more than marks, children will enjoy if they're competing against each other to see whether they've understood the concept clearly or not. So I think basically just need to make teaching a whole lot more supportive and a whole lot more fun.
Okay. As a parent of young daughters, do you find quality time to speak to your children, or are we guilty of that as a society?
I think I'm trying my best. I always try. What I prefer is maybe if you can go outside in the evening, even for half an hour, or I try to spend time rather than at home, maybe outside. Yeah.
So would that also work? So long as the mobile is switched off.
Yes, right. Any kind of time with the child, whether it is outside, inside, the parents have to talk to the child regarding different issues. If there are no issues, just talk about different things. what is happening in society.
Yeah, give us some talking points.
Let's assume what is happening in the cricket. Just talk about cricket. It's not about the cricket that they are talking. It's the bond that they are forming. When there is a bond, the child can come and discuss any issues anytime without any fear, without any judgment. So it's not cricket, boxing, sports, running, peers, school, education, anything can be discussed. Religion, spirituality.
But what if, Sapna ji, a child is watching, say, excess of internet or mobile, parents are trying to do that talking, but the child shouts at you. He is showing opposition behavior, not listening. Then
Now, this is where parenting becomes really hard. You have to put your foot down. You have to tell him that you are the boss and you're going to stick to it. Of course, your heart will melt as a mother or as a father that no, he's crying, I must give in. But you have to hold fast, because if you hold firm, he'll try it once, he'll try it twice, because all he's doing actually is trying to get your attention or to get his way. And once he knows that he can't get his way, he will fall in line.
and even among the peers, over the last year or two, you would agree that some of the children have started using foul language as well. And sometimes your neighbor comes to you and tells that your child was using a foul language with a friend. How do we address that?
Well, I think it all depends actually, because we cannot just follow one strategy,
Right.
because every child has a different way to interpret things. Accordingly, we need to customize that thing.
But in your experience, have you witnessed those cases where children have started using
Right,
foul
sir.
languages?
We have definitely witnessed. So there are certain strategies that we can use. We have to understand what is the reason for foul language. Either it is the child is enjoying. If the child is enjoying using a foul language, it's not just foul language or engaging in aggressive behavior or bullying some other people. So we can take these certain rewards from the child. Take the mobile for 1 day, for 2 days, for 3 days, for few hours. Just tell the child, okay, if you do not listen to me, if you cannot stop your foul language, I will take certain things. Okay, I will not give you pocket money for 2 days, for 1 week. Let's say the child is stressed and then the child is using foul language because the child does not know how to communicate properly. Then we have to see the stress also. We have to remove the stress if it is possible, or teach the child some other ways to express stress through the use of theater, through the use of dance. Some other strategies can be there. So we can address through these two things. Either address the stress, or if there is reward, either address that reward by taking the other kind of reward. So that sometimes works, sometimes does not. If it does not work, bring a child to some other person who can talk through some other means and some other manner, because the parents have been trying a certain kind of ways for very long. So maybe some other perspective is needed.
Right. Final words. Family plays a very important role to develop that bond with the children after all.
I think as a family, we need to spend more time together.
Spend more time together.
Absolutely. Take vacations together.
Yeah.
Go to places where you're not only shopping, but actually spending time with each other, discovering new things. Listen to them, talk to them, because you are the greatest support your child is going to have, and you need to be there for your children.
Dr. Jatin, final words on the role of the family.
A good family is a unit for a good society. If there are proper families, they are raising proper children and adolescents, then a society can be good. If the family is neglecting, or they are abusing themselves, or they are using mobile phones altogether, the child growth will not be normal. The child will definitely develop one or other kind of problems. So if we want to have a good society, we have to focus on families, and we have to teach families how they can be helpful in the growth of a child.
And if you as a family have listened to the national program of talks today, where we have focused on how COVID-induced lockdown and restrictions have impacted the life of a child, that is also a step in the right direction. And for helping us build the new perspective, to all my guests, Sapna ji, Dr. Jatin and Sachin, thank you so much for joining us.
Thank you so much.
Thank you very much.
Thank you.
In our national program of talks tonight, you were listening to the panel discussion entitled Are Young and Lockdown. The panelists were Sapna Bhatia, co-founder and chief content officer of one of Asia's leading education service providers, Dr. Jatin Tarwani, well-known psychiatrist, Sachin Gupta, filmmaker and theatre in education expert, and Amit Arora, media personality, who initiated and moderated the discussion. Produced and presented by Naveen K. Gupta of All India Radio Delhi, this program came to you from the Delhi station of All India Radio.